this introduction to anatomy of male genitalia. My name is Putri Halleyana. The genitals are the reproductive organ. Together, they form the reproductive system. In this video, we will only focus on the male genitalia, while the female genitalia will be extensively covered in the next block. As within the females, the male genitalia also generally divided into internal and external organs. This division is based on their locations. The internal genitalia comprises organs that deals with production and maturing of the germ cells. They also responsible for hormonal secretions regulating the processes. And by the name, they are also located inside of the body cavity, mainly in the pelvic cavity. The external genitalia, on the other hand, mainly functions as the delivery organ, so that the germ cells between male and females can meet. As the name suggests, it is located on the exterior part of the body, not inside the cavity. The male internal genitalia consist of generally the glands that produce various secretions and the ducts that carries the sperm, along with the secreted substances from these glands. The ducts here depicted with the blue floating buttons, while the glands are the ones cream colored. As we see here, the duct follows the course of the sperm, starting from the testicle, where it produced inside the minuscule ducts inside the testes, to the epididymis, and then into the ductus deferens, also called vas deferens, and finally into the ejaculatory ducts. And also we see here, we will briefly talk about the seminal gland, the prostate, and vulvourethral gland that is also called the Cowper's gland. The testicles, or a pair of testes, is the main internal male reproductive organ, because here happens sperm and sexual hormone production. As with other internal organs, testis also has protective layers. The tunica vaginalis, derived from the peritoneum, has parietal and visceral layers, and also tunica albuginea, which is a tough fibrous layer that invaginates testes and divide them into lobules. We are moving on to the vascularization of testes. The testicular artery on both sides is a direct branch off of the abdominal aorta. It runs inside the spermatocord, while the blood goes back from the testis via 8 to 12 vessels, a network of, we call it campaniform plexus. They are converging into testicular veins. The difference lies to where they drain, because the right testicular vein drains directly into the inferior vena cava, while the left one drains through the left renal vein. What about the lymphatic? The lymphatic drains from the testis, follows the artery and the vein course to the right and left lumbar lymph nodes, and also pre-aortic lymph nodes. The testis supplied by the autonomic nervous system. The sympathetic component branch from the level thoracic 10 to 11, while the parasympathetic is still the branch first from vagus nerve. Both nerve forms testicular nervous plexus. Here we see the male genitalia. This part is the external part. We will peel off the skin so we can see the inside. Okay. More or less, these are the entirety of the male genitalia. I already removed a lot of the structures, so you can see the genitalia better. This is the testis. I already peeled off the other layers, so you can see only the testis here and the epididymis on the outside of it. Okay, I removed the tunica albuginea first, and then you can see the minuscule ducts of the testis. These are where the sperm produced, these small minuscule ducts, and then this one part of the testis is called the testis lobules. So you can visualize it better. Please, this is the rete of testis, and it will go into the epididymis ducts or the ductus deferens from several rete testis ducts. Please review again in your textbook about these structures. And what about the vascularization and innervation we talked about earlier? The vascularization and innervation goes from the spermatic cord just like the other structure in the testis. Now we're moving to the next structure. Here we have the epididymis. It is formed by minute convolutions of the duct of epididymis. It is so tightly compacted that they appear solid. Here we have several parts of the epididymis. It has head, body, and tail. The head comprises of 12 to 14 afferent ductals, while the body is the major part, and the tail sort of tapering continuation of ductus epididymis. Here is the epididymis. As I said before, it is a compacted ductus of epididymis. It's very packly tied together that it appears solid. This is the head, and then this is the body over here, and then it tapered off into a tail. On the end of the tail of epididymis, this part here will continue into one single vas deferens or ductus deferens that we will talk in the next section. Ductus deferens or vas deferens, they are basically the same. Begins in the tail of epididymis, ascend posterior to testis, medial to epididymis, and then it runs inside the spermatic cord. After that, it goes through the inguinal canal and enter the pelvic cavity. It ends by joining seminal gland ducts in the posterior part of vesica urinaria. Here, in the most distal part, it enlarged to form ampulla of ductus deferens. So, oh, where does it go? Oh, there should go. Here, in the most tail of the epididymis, we have the ductus deferens. At first, it's still convoluted, and then as it goes upward here, this where it go along the spermatic cord through inside, goes inside the pelvic cavity, and then turns here after this is the anterior part of the pelvic wall, and then it goes under. This is the peritoneum, so it goes subperitoneal. It's not covered by peritoneum, it goes under the peritoneum. Let's remove the bone here first to give you a better view. There you go. Then it goes posterior to the vesica urinaria. Here, it's very long. And towards the end, over here, it's sort of enlarged into ampulla of ductus deferens. Okay. Oh, sorry, I haven't talked about the arteries and the veins of the ductus deferens. The artery of ductus deferens derives from superior or inferior vesical artery because it's close to the vesical artery, while the vein joins into the testicular vein. Now let's talk about the seminal gland. It's not part of the ducts, so it is called also the seminal vesicle. It produces and secretes thick alkaline fluid, contains fructose and coagulating agent to help the sperm survive. It is located between the fundus of the bladder and the rectum. Its superior part covered by peritoneum. Let's see here the vascularization, the arterial blood supplied by the inferior vesical and middle rectal artery because it's close to the rectum, while the vein follows the artery. Here, we can see here the seminal vesicle. We have two. This is the rectum. It's, as I said before, it is located between, anteriorly it's the vesica urinaria and posteriorly it's the rectum. It's actually a lot more closer, but because this is animation, it appears like very far from each other, but actually in the pelvis it's very tightly compacted, so it's a lot closer than it looks. And then don't forget that everything I talked about, the testis, the epididymis, the vas deferens, and also the seminal vesicle is a paired organ. So this one is the left one, and the right one is over here. I can give you a rotating look, but it will be blocked by the bone that I haven't removed here. Okay. From the seminal glands, we move on to the ejaculatory ducts. What is the ejaculatory duct? Well, it is the merging of the ductus deferens and the seminal gland from both sides. I mean, on each side, it is approximately 2.5 centimeter long. It is located in the neck of the bladder. It then undergo antero-inferior course through posterior part of the prostate. And then the duct, that short duct, opens into the seminal colliculus. For the vascularization, it is supplied by the artery of ductus deferens, which is very similar, and drained via prostatic and vesical venous plexus. You can see here, it's too close, I'm sorry. Yes, this one. You can see that this is the seminal vesical ducts, and then this is the vas deferens. They merge inside the prostate. Let me remove the prostate here. There you go. And we can see the inside. These are the ductus ejaculatory or ejaculatory duct. It's only approximately 2.5 centimeter length in length. Okay, this one is the ejaculatory ducts. The course is mainly inside the prostate, and then it opens into the seminal colliculus. Seminal colliculus is the part of the prostatic urethra over here. Okay. Now, as we talked about the prostate, we will talk about the prostates. It is the largest accessory gland of male reproductive system. It is often compared to walnut because it sort of resembles the walnut. It is around 3 times 4 times 2 centimeters in size. It has a prostatic duct that opens into a prostatic sinuses on either side of the seminal colliculus. It transports the thin, milky prostatic fluid. This fluid makes up 20% volume of the semen. It serves as the sperm activator. So it is very important. Let's see here. The prostate has layers. First, it has the fibrous capsule, and then it has the visceral layer of pelvic fascia. On the anterolateral side, it goes from prostatic sheath to puboprostatic ligament, while on the posterior side, it goes from the prostatic sheath to rectovesical septum. And the parts here, it has the base and apex. The base is more on the superior side, while the apex is on the inferior side. While it also has surfaces: anterior surface, posterior surface, and inferolateral surface. And it's also divided by its zone, peripheral, around the prostatic urethra. The central is around the prostatic urethra, and the peripheral zone is the ones that more distal to it. And then histologically, we also divide them into lobes, the isthmus on the anterior side, and then we have the right and the left lobe. What about the vascularization? The artery is derived from the inferior vesical artery. It's very close to the vesica urinaria. And then the vein, we have the prostatic vein. Okay, let's see the prostate. Okay, here is the prostate. We already have a glimpse of it when I try to show you the ejaculatory ducts. So this is the prostate by itself. Let's see here. It comes whole again. I want to isolate the prostates. Okay, this is the prostate. 3 times 4 times 2 in dimension, and sort of resembling a walnut here. And then it has the anterior side. This is the apron, the detrusor, and then this is the ligament that attaches the prostate to the pubic, or we call it puboprostatic ligament. You have a left and right part. Directly superior to it is the vesica urinaria, and then directly below it is the perineum, the male perineum. Okay, let's see the inside again. Okay, this is the central zone, and then you can see some sort of line demarcating here. This is the central zone, and then the outside to it is the peripheral zone. And then we have the surfaces, anterior, superior, and then inferolateral over here. Okay. Now we move on to the bulbourethral gland. It is located posterolateral to intermediate urethra. It's embedded in external urethral sphincter. This pea-sized gland is also called the Cowper gland. It has ducts that opens into minute apertures into the proximal part of spongy urethra in the bulb of penis. It contributes to male reproductive physiology by secreting mucus-like substance during arousal. Okay, we will see the bulbourethral gland or Cowper glands. It's very small. We need to remove this external urethral sphincter. This is the male external urethral sphincter on the right side. We hide this. Then it will reveal the bulbourethral gland. Like I said, it's embedded inside those muscles. You can see this is like a small balloon, and with the stalk is the bulbourethral gland ducts, and it releases or it secretes the mucus-like substance into the spongy urethra. This is the spongy urethra, and this is the ducts of the bulbourethral gland. It's actually longer than it appears. Now we're moving on to the external genitalia. We will talk about the scrotum and the penis. First, the scrotum. Located posterior inferior to penis, the scrotum is a cutaneous fibromuscular sac that houses the testicles. The scrotal raphe in the middle of the scrotum is visible by the naked eye. It originated embryologically from 2 halves. So it's continuous with the penile and perineal raphe. The raphe is the continuation from the 2 halves. The division of the scrotum, however, continues to the internal part, not only on the outside. It is continuous by the septum of the scrotum and a continuation of dartos fascia. The scrotum exists because the testicle needs certain temperature for its metabolism, and they are relatively lower than the body temperature. Hence, it requires a compartment of its own. In the video, we'll see the scrotum. If before we talked about the testis in the inside, the scrotum is the sac from the outside. Let's Uh, Rewind a little bit in this. Oh, wait. Oh, there you go. Okay, this is the scrotum, but we need the skin of the scrotum. The inaccurate part in this animation is that it's very smooth, while in reality, the skin of the scrotum is much more rigged and have wrinkles. Not as smooth as depicted in here, but it's more wrinkled. It has texture and it has relatively darker appearance. Okay, let's go back to the slide. Here we see the artery of the scrotum. It's from the external iliac and internal iliac branches, and then the vein, the scrotal vein, it goes to the external pudendal vein, while the innervation is almost completely somatic innervation. Is the anterior and posterior part. Anterior scrotum is from anterior scrotal nerve, which is the mix of ilioinguinal nerve and the genital branch of genitofemoral nerve, while the posterior or posterior scrotal nerve is the superior perineal branch of pudendal nerve and perineal branch of posterior cutaneous nerve. Yeah, you can see it more clearly here. And then next we are talking about the penis. Penis is the male copulatory organ. Its function is to deliver the sperm to the female genitalia, so the sperm and the ovum can meet. The penis in general has three parts. First, the root, it's the closest to the trunk, and then the body, the main part, and then the glans or the tip are the head of the penis. Main feature of the penis are the erectile tissues. It consists of two corpora cavernosa and one corpus spongiosum. Each of the cavernous body covered by tunica albuginea, it's the same fibrous covering with the testis. Deep to it are the deep fascia of the penis, or we call it pars fascia, which is a strong membranous layer. The corpora cavernosa, I say corpora because it's a pair of corpus cavernosa. So the corpora cavernosa fused with each other in median plane from the crura of the penis. We will see what I'm talking about in the video later. And then later on, it's separated by the septum of the penis. While the corpus spongiosum takes on the central part of the penis and it contains the spongy urethra. Now we will see here the penis itself. This is the main male copulatory organ. It's on the flaccid state, but it is actually on copulatory. It needs to be erected, so it has the erectile tissue. So we see here the root of the penis. Wait, I need to take off the skin first. The root of the penis here, the root, has sort of three parts. The first part is the crura, or the crura is sort of the feet of the penis. We have two crura here, this one, and then this one on the left side, this one on the left side. It's actually the origin of corpus cavernosum, this one, and then it's merged into one here, while the bigger one here, this one, is the bulb of penis, and it's the origin of the corpus spongiosum. The body of the penis here, this is the root, and then this is the body here. It's sort of a pendulous appendage that is suspended from the pubic symphysis. From the outside to the inside, let's see here. Hide this. We can see that on the outside it has the skin. It's very thin, the skin on the penis, and it's relatively darker than the other part of the body. And then it has a thin collective tissue as well. And then after that, we have some lymphatic and blood vessels. I forgot to turn that off. Let's see. There. And then after the blood and lymphatic vessels, it has the fascia, and then the erectile tissues. On the most inner part, it has the urethra as well. There you go. There's the blood, uh, blood vessels. There's the artery of the penis. This one, I believe, is that's the dorsal artery of the penis. And then it has several branches branching off here. There you go. It's still the dorsal artery of the penis. And then this is the box. This is the tunica albuginea of corpus cavernosa on the right side. This is the corpora cavernosa. Because it's one, it should be corpus cavernosa on the right side. Okay, let's try to isolate this. This is the corpus cavernosa on the right side. I want to show you the internal part, but I don't think we have that feature. So we'll leave it at that. And then there's no muscle in the body of the penis, so you need to remember that all the erection action came from the fluid or blood that fills the sinuses in the inside of the corpus cavernosa and spongosa in the body of the penis. Okay, and then we move on to the glans penis here, or the head of the penis. It has several parts. First is the corona, the one that sort of bulging here. This is the corona, and then I need to show you the skin first. Okay, it's not very visible though. Okay, there you go. This is the corona of the glans penis, and then the neck is the rightly below that here, this part, and then we have the external urethral meatus, this one, or the external urethral orifice, this. It is covered by preputium or prepuce, the part where gets circumcised in a penis. So this is, unfortunately, this module here we have, it doesn't have the ability to show you the true prepuce. We need to see that on the cadaver. So I'll let you use your imagination here. So the prepuce or preputium is the prolongation of skin and fascia, and it's sort of double layer skin. So it, like a sleeve, this hand. This is the glans of penis, and then if you have a sleeve, kind of elongates over there, like that. And then on the medial posterior side, it has the frenulum or medium fold. Where did it go? Oh, here you go. Okay, and then let's go back to the slide. Here we go. We have the erectile tissue. Again, we have two corpora cavernosa and one corpus spongiosum. But as the physiology of the penis depends wholly to the blood flow, therefore it is very important to understand the vascularization. Okay, we have several arteries here. It derived from two different pudendal arteries. You need to review it yourself, whether it is from the external or internal iliac artery. But the branch from internal pudendal artery is the dorsal artery, and then there's the deep arteries. This is the one that you need to review very well. We don't have it on our video, but you need to look for other videos that shows you the deep arteries, in which layer is it located, because the deep artery fills the cavernous spaces that involves in the erection, in the physiology of erection. Also, the Halleyana artery of the penis, of which shrivels and doesn't contain any blood during flaccid state, and it engorges with blood after the action of erection started. And then we also have the arteries of the bulb of the penis. That's from internal pudendal, While from external pudendal artery, we have the superficial and deep branch, which supplies the penile skin. This is very important so that you understand that what the blood that goes inside of the penis, inside of the certain fascia, has different branch vascularization from the skin in the outside. This is very important to the physiology itself. So the blood doesn't get cut off during erection process. So the skin doesn't get necrotic and stuff. And then we have the vein. We have the deep dorsal vein and the superficial dorsal vein. Again, it's very important to have different supplies here because the cavernous spaces, the blood that goes from the Halleyana artery before, it fills the cavernous spaces with blood. And then during erection, the venous will get uh, constricted so the blood doesn't flow back. So it's held in the cavernous spaces or in the spongiosum spaces. Then the penis will get engorged. And then after that's happened, the blood from the cavernous spaces goes back to the venous plexus and then goes back to the prostatic venous plexus, while in the superficial dorsal vein, which is in the skin and subcutaneous tissue, it didn't get affected by the erection itself. So the blood still goes like as usual, even though the penis is in the erected stage. Uh, the blood from the skin and subcutaneous tissue goes to the superficial external vein, to the pudendal vein, and then while the blood from the pudendal vein goes to the great saphenous vein. Okay, and then what about the innervation? You need to remember that the innervation of the penis, again, we have the somatic innervation that sends and receives impulses, and then we have the autonomic one. The impulses is involuntary, of course, and then the somatic we have here, the ilioinguinal nerve. It supplies the skin at the root of the penis, and you need to look up by yourself again which are the nerves that supplies the skin of the penis, the scrotum, and the perineum. And then the autonomic nervous system. Here I have one, the cavernous nerve. It is the branch of parasympathetic fibers to the Halleyana artery and erectile tissue. So when it's stimulated, the Halleyana artery that's normally collapsed will be open, will have a vasodilatation, hence it will fill the cavernous and everything. So please review again about the innervation and vascularization of the penis so you will understand the physiology of the erection. Okay, that is all from me for the introduction to the male genitalia. Hopefully, it will stimulate you to read more and more about the topic. Thank you all. Good day.